Hey everybody, Dr. Rob Silverman here, Facebook Live. Great question. It was on the news last night. A lot of people asked me, we're going to cover it. Should we wear the mask or shouldn't we? I mean, what's the skinny on it? Will it protect us? Does it protect everybody else? But first, as always, I always want to thank the support from Creator Chiropractic Clinic PC, Dr. Mike's Warren and Dr. Mike's Powell. They are without question supporting the Facebook Lives. We have some other people that want to affiliate with us. They're coming in. Anybody listening, do me a favor. Give me a shout out. Let me know who's listening. Ask a question. We had a lot of good questions. We're growing in our questions. We're growing in our group. We're growing in our cadre. So if you will, ask the questions. I'm here to help. You know, if you don't catch it live, catch it on a watch party. If you don't catch it on either one or two and you see it a little later, go in the comment section and ask a question. So the mask, it's a great question. So my opinion and what the literature deems, and Dr. Fauci also talked about it, is, yeah, the mask is probably a great choice. But first, the caveat, not taking those health providers' masks, those first responders, those people who need them, you know, again, I'm in New York, that need them in the hospitals. If we have them and they're not needed in the hospital, yes, the mask is a great choice. A couple of reasons that the mask is such a good choice. Number one, everybody wants to touch their face. Every 2 to 5 minutes, Americans touch their face. We don't want to touch our face because the virus can lay inactive on our hand. We are great hosts because we're made of protein and fat. The virus loves that. We touch our eye, we touch our nose, we touch our mouth, we get it inside in our respiratory area, and it goes to work. The mask will remind us not to touch our face. So that's number one. Great choice to wear the mask for that. Number two, if I were to be sick, and hopefully I'm not, and asymptomatic, which I think it's conceivable that a lot of us, 25%, there's a study in here that talks about being asymptomatic. You may be asymptomatic, not be testing positive, yet you could still spread it. So of course it's spread through the aerosol, spit, as we talk and get close. The mask will protect us from sharing it with somebody else. And on the reverse, conversely speaking, it's probably quite protective if someone was to give us some sputum and get it on the mask will protect us. Unfortunately for the health providers down in the cities and in the hospitals in the other states, they're using the same mask multiple times. It's not as sanitary, but for us, you know, if you're going to go to your supermarket, your Whole Foods, you're not going to look funny if you wear a mask, and you're not going to look funny if you wear gloves. You're protecting yourself and you're protecting others around you because this data is very clear. The social distancing, which is really physical distancing, is needed. The more that the countries have distanced themselves, the better and the flatter that curve now becomes because we're getting tests. That's another thing. They're talking about the 15-minute test. That would be great. So if I think I've been exposed, I get online, I take the test, I wait 15 minutes and they tell me yes or no. Once that comes, that's going to be a bit of a game changer in addition to the antibody test that we talked about yesterday. The other thing I want to talk about, good question. Someone had emailed me yesterday about autoimmunity and its effect on our immune resilience because everything's all about our immune system, boosting, supporting, and our immune resilience. So autoimmunity obviously is a break in our immune system. So with that, having said that, what is autoimmunity? Well, let's go through the immune process once again. We have two immune systems, if you will. Innate, which we've had for day one, and adaptive, which we kind of got as in human species about 10,000 years ago. The immune has these killer T cells and T cells. The adaptive is all these immunoglobulins, B and T cells and things of that nature. Usually autoimmunity is a break in the adaptive immune system. So if you have that break, you've got a break in your immune system. Autoimmunity is kind of like rheumatoid arthritis, believe it or not, osteoarthritis. Thyroid's considered autoimmunity. Some other different conditions are deemed autoimmune. So autoimmune typically will put a strain on your immune resilience, as we've seen that autoimmune conditions are one of those comorbidities that are unfortunate that increase your incidence of one, getting COVID-19, in addition to getting COVID-19, having a bad outcome with COVID-19. So your immune system and autoimmunity, once again, is an issue. Those people who are autoimmune compromised really need to be even more cautious. And those of us who are not, like myself, fortunately, need to be cautious, in reference to the social distancing, maybe wearing the mask, and all of the like. In addition, there was a new study that came out yesterday, and it was interesting that they reported that people with select underlying conditions are at a higher risk for severe illness from COVID-19. 71% of the hospitalized people with COVID-19 in the U.S. and 78% are in the intensive care have underlying health conditions, and the three are chronic lung issues, diabetes, and heart disease. And you can go to the cdc.gov to see that. So those are the three big ones. They've really started to isolate that down. In addition, as I said before, now we're talking about 25% of people are walking around asymptomatic. And the symptoms can lay in you and can show their evil root for about 25 days. Now, that 25% actually came out yesterday, March 31st, 2020, and that was Dr. Robert Redfield. He's the director of the Centers for Disease Control. Some other people wrote in and asked me a question: can the virus lie on clothes? So when you go, is it lying on your clothes? Is it lying on your shoes? So the suggestion is when you go outside, you go shopping, you go to Whole Foods, whatever local shopping, D'Agostino's, whatever it is that you use, the best idea is to, without question, take your clothes off, change it, and wash it. So a lot of people asked, what's the best detergent? We haven't seen any studies that talk about the best detergent. What we have seen is definitely as hot a cycle as you can without shrinking your clothes. The temperature setting is critical. So once again, if you go out, not so much if you walk around, but if you walk around in a store where there's been probably hundreds of people, some people have touched the stuff that you've seen. These pictures are excellent. I can't get my trail mix unless it's packaged because you can't open anything. They're afraid somebody will touch with their hands. Clean your clothes in a hot setting with a detergent. Now, came across one of the supplements that we recommend often, and it's called melatonin. So there's something called the cytokine storm. We've talked about it before. The cytokine storm is this overactivation of our immune system, sending out something called cytokines. These cytokines release these IL or interleukins. Interleukin 1B and interleukin 18 are the most common ones, coming from the NLRP3 inflammasome. So you get this overload of interleukins, and these overload of interleukins can be very damaging to people's health. So we want to keep the cytokine storm at bay and decrease the amount of inflammation so we don't have this storm. Melatonin, as we talked about. Melatonin is a great choice to take. This was a study in 2020, March 23rd, Life Science. I highlighted some of the things. Some of the conditions that occur from the cytokine storm is what they call ALI, which is acute lung injury, or ARDS, which is acute respiratory distress syndrome. So that's really the end result of an overactive cytokine storm in the lung area. So here was the conclusion. There was significant data showing that melatonin limits virus-related diseases and would be likely beneficial in COVID-19 patients. So melatonin, 20 milligrams, excellent choice to decrease the cytokine storm. In addition to that, while I'm on a roll, and then I'm going to answer all the questions, turmeric is another great choice. Pro-resolving mediators, believe it or not, fish oils, and for me, vitamin C and vitamin D are still excellent choices.
How do we get or increase melatonin?
How do we get or increase melatonin? Well, there's two ways to do it. Well, there's three. Make ourselves about 8 years old, but unfortunately, even I can't do that. Younger people have a higher level of melatonin. Good quality sleep allows our body to release the melatonin. So that's a great choice. And the third choice is, and I have recommended this one, to supplement with melatonin. Again, 20 milligrams should do the trick to help quench the cytokine storm. So any shout outs, questions?
Thoughts on electrolytes?
Thoughts on electrolytes? That's a great question. And I'm a big proponent of electrolytes. So at the end of the day, as we say, we need to keep ourselves as healthy as we can. So obviously that starts at home. I just saw Arnold Schwarzenegger, not personally, I saw him on Facebook. And he was all by himself with his truck and he had one barbell. Now, here's Arnold, and it's Arnold. Let's be real. I grew up on Arnold. He had one barbell and he was doing all the different exercises. He's outside and he says, you know, you have to take care of yourself. So he was by himself. I don't know if someone was holding the phone or what. And he was exercising. So great choice. You got to take care of yourself. Another great way to take care of yourself is watch what you eat. Electrolytes are a great choice because electrolytes will give you ample energy to exercise, recover. If you're on a ketogenic diet, electrolytes are also a great choice because they'll support you so you don't get what we call the keto flu and the aches and the tiredness that comes sometimes with the ketogenic diet.
Dosage of vitamin C, D?
Dosage of vitamin C and D. Vitamin C, interestingly enough, in the ascorbic acid for the cytokine storm is a gram every 2 to 4 hours. Vitamin D3, a minimum of 5,000 IUs with K2. If you're a bigger person, 250 pounds, you may want to go up to 10,000 IUs. Great. I know there's been some questions on the cytokine storm. Real good literature. Vitamin D puts the brakes on your aberrant immune system. It's also been shown to help with respiratory illness. I can't see how vitamin D would be adverse, especially if you take the right amount, between 5 and 10,000 IUs daily, depending on your body weight with K2.
What about increasing humidity in the house?
Well, that's a great question also. You know, the humidity is an interesting question. It's not good for my hair, but I'm just trying to add light to the situation. Humidity also allows mold to grow. So I think I would keep not necessarily the humidity high, maybe I would be in a little bit of a warmer house. Maybe instead of your 64 to 68, maybe go 68 to 70 degrees. That's an interesting question. And you know, one thing I've noticed, and it's over the last 2 weeks since I've been home, and every day we've been doing this, and podcasting and webinar and everything, the proverbial epiphany that we've had about what a virus is, how it acts, why we're such good hosts, our immune system, the gut to lung, which we're finally going to get to at some point, all the new things. It's just a horrible thing that people had to get sick for us to expand our knowledge. But again, I believe that if we take the necessary steps, things will be better. And I think we have some more shout outs and questions.
What electrolytes would you recommend with no sugar? I have a hard time finding good ones. And Betsy said, why is Gatorade a bad choice?
Ooh, okay. So I'm going to take the second before the first. I'm going to take the latter before the former. So Gatorade's a bad choice because Gatorade has sugar. Now, and Gatorade also, it has artificial sweeteners, artificial coloring. So I'm not a big Gatorade fan. Want to really be careful what I say. This is live. I don't want to have to get shut down by Gatorade. So what I recommend, and we'll put the link in. We can put a link in after. I recommend something from Nutridyne called a Hydrate. It's excellent. I take it at home. I take that with a Dynamic Greens. So we'll add a link where you can go right to my online Nutridyne store and get a Hydrate. Love it. Every morning I take that with the Dynamic Greens and it invigorates me. It gets me going. And I think electrolytes are great. In addition to what I said before, I think electrolytes are excellent because they allow you to navigate during the day with more energy, and more so than that, they're also good for your gut. Now, I would think the question was a Gatorade and electrolyte. I think I answered them.
Vitamin C, vitamin D recommendations, daily dosage?
I think we got that. So vitamin C, again, for the cytokine storm in this time, you know, 1 gram every 2 to 4 hours.
Natural ACE2 inhibitors?
Natural ACE2 inhibitors. Nice question. Excellent. You know what? I'm going to do a whole Facebook Live on natural ACE2 inhibitors. How does that sound? Now, interesting, that's a critical element, and I just want to tell you this. I'm going to give you the little seed for tomorrow's conversation. You guys stole some thunder. The ACE2 inhibitors that we're talking about, the ACE2 receptors, I should say, are plentiful in your lung, your gut, your liver, and your kidney. And that's one of the reasons with this spike protein that so many people can get ill, you know, fatally ill, but ill for a period of time because it can attack multiple organs and multiple structures at the same time. So tomorrow we're going to do that. That was my topic. That was the best amount of questions I've had. I'm really pleased about that. Feel free. Anybody else asking questions, I'm going to answer. Remember, we're in partnership with Creator Chiropractic in Medford, Oregon. I forgot to say that. I want to make sure. I know Mike Powell's watching. He's laughing, he's smiling, and he's waving. Hey, Mike, how are you? Waving. Do we get any?
Wants to know pro and prebiotics.
Pro and prebiotics. Great question again. These are really good questions. So what are probiotics? Probiotics mean pro-life, probiotic. Probiotic is bacteria that we need. Our body communicates with probiotics. Our gut actually communicates with the probiotics. The more good bacteria versus bad bacteria, the better health outcomes we can get. Interesting in that most people don't even know the right number. We need about 85% good bacteria to 15% bad bacteria to have the right amount. If we have an unleveling of that number, not 50-50, but 85 and 15, we can have something called dysbiosis. Dysbiosis can lead us down a path of leaky gut. 80% of our immune cells are in our gut. If we damage our gut, we're more susceptible to immune dysregulation. So everybody, unfortunately, is not talking about gut health enough. Rob Silverman and everybody else, we're talking about gut health. So getting a good cornucopia, diversity, individualizing it if we need to take a test for our own gut microbiome and microbiota health. So it's the microbiota, which is your bacteria, to your gut, and actually from there to your different organs, and one of which, of course, is your brain. Having said that, the communication in your gut to your brain, one of the main communicators is something that we talk about, vagus nerve, and I think we'll do a whole vagus nerve and how that gets involved in this immune. So that's a probiotic. It gives life. A prebiotic is something that feeds a probiotic. It's your fertilizer. It's your miracle grow. Without that, your probiotic is not as effective. So many people take a probiotic and don't understand that they can eat or supplement with a prebiotic. Good prebiotics: garlic, onions, leeks, Jerusalem artichoke. Some kombucha if you really like it, not so bad. Fiber, your choices between your different types of fiber are also a great choice. You want a prebiotic to feed your probiotic, because if you don't feed your probiotics, even though they're good and bottled and all that kind of stuff, they will turn around and damage your intestinal tract. Because as my dad called probiotics, they're what we call bed and breakfast renters. If you feed them, they're great guests. If you don't, they can break up the house, and your house being your gut. So prebiotics to feed probiotics. The best supplemental prebiotics, so everybody knows, is something called XOS, xylo-oligosaccharides, because it only feeds the good bacteria. We have to be careful with some specific quote-unquote prebiotics because they feed both good and bad bacteria. And in this time, our most important thing that we can do is keep our intrinsic gut healthy via probiotics. Make sure you feed them pre and pro. And something to talk about, I'm sure we have more questions. The pre and the pro leave you what we call the postbiotic. And that's what's left there. And that's actually like your short chain fatty acids. But not to get too technical, I got some questions popping up.
No, Mike Powell just say, wow, dad wisdom.
Dad wisdom. Perfect. No, we're good? All right then. So it's been great. Every weekday from 1 o'clock p.m. Eastern time, we do about 15 to 20 minutes. Ask all your questions. We get a lot of communications after. If you have any topics other than the ACE2, let me know. We'll cover it. I have no problem doing one on Saturday, on Sunday, whatever we need. We're just trying to be here for you as a source. Tell your friends, Dr. Robert Silverman, like it. Also, we have a YouTube. I'm doing these on LinkedIn. My Instagram is Dr. Robert Silverman also. So we're feeding it into Dr. Robert Silverman. And for all those practitioners, I know we have another question. We just started a laser group. So if you're interested, DM me. We started a Dr. Rob's Mastermind laser group.
Randy wants to know if you have a class or program for doctors.
I do. I actually do, Randy, if you would. We're starting it actually on Monday. In that so many doctors have asked if we could do individual, and we've been doing individual for the last year, and we're also opening up to a Zoom class. So if you would, give me some contact information, and we'll put you on the list. Ellen, how are you? It's good to hear from you. I'm happy you were able to follow everything, and I hope all is well, and I'm doing the best I can. So We are good?
Betsy thing.
Yes. Come on, let's get some shout outs. Come on, I want to hear who's watching. Give me some shout outs. I know there are people there.
Betsy.
Hi, Bets.
Randy Goins.
Randy, how are you? Where are you from, Randy?
Brian Opp was the one who wanted to know about the natural ACE2 inhibitors.
That's a great question. I'll take care of that tomorrow because that's involved.
And the electrolytes with Kendra.
Kendra, how are you? All right.
And
So, Dane, my good friend Dane, 8 Weeks to Wellness. Dane, you've got to give me that information. I want to share it with everybody on the Facebook Live. Let me know. I love what we talked about. Dane Donahue, 8 Weeks to Wellness. There isn't a better chiropractor, healthcare advocate in the world, and you don't even owe me for dinner for that. I'll buy you because that is the truth. It comes from the heart.